And what are we going to talk about today?
Today we are talking about Sculptra because
Ooh.
it's gotten a lot of buzz recently. A lot of people are talking about it, and it is something that I think not a lot of people quite understand what it is. So do you want to kind of go over what is Sculptra?
Yes, Sculptra is not like your typical dermal filler like your Restylane or your Juvederm. It's actually a biostimulator. So the medical terminology, it's PL lactic acid, so PLLA. Basically, what it's doing is it's rapidly stimulating your own collagen production to kind of help with fine lines, folds, wrinkles, texture. It's not instant, So if someone came in and said they had a wedding in a month that they wanted to go to and wanted a little refresher, I wouldn't suggest Sculptra because it does take about anywhere between 60 to 90 days to start seeing the results, and you need 2 treatments spaced about 4 to 6 weeks apart. And then the nice part of Sculptra is that it does last all the way up to almost 2 years.
Yeah, which is awesome. People
Mm-hmm.
love that. And so it's kind of doing the same thing as a filler. It's filling an area where you've lost your volume, but it's doing it in a different way, right? We're not injecting something artificial into the face. We're injecting what we call a collagen fertilizer. So we're trying to get your body to do the work for you. So it's creating more collagen, trying to revolumize that area.
Yeah, and there's no like you have to do one or the other. Like a lot of times in our practice, it's kind of a balancing act between when do you need Sculptra, when do you need the filler, or sometimes it's both. Because there's the nice part about Sculptra is that you can inject it into areas of the face that I wouldn't traditionally put a dermal filler. For example, if someone has a lot of those like smile, what we call rhytids or smile crevices or creases that come at the lower face, or if they have some temple hollowing, or if they have cheek hollowing, those are all areas that we don't traditionally put fillers or dermal fillers, so we like to use Sculptra in that, and it's going to get you a very natural kind of lift or response.
Yeah, and I think that's important to note because Sculptra has come a long way from when it first came out, right?
Yeah.
And so some people have been a little hesitant about Sculptra because when Sculptra first came out, it was primarily used right in the cheeks.
Mm-hmm.
And so some people felt like they looked overfilled in the cheeks. But now we kind of spread that Sculptra out more.
Yeah. So think of fertilizing your face with a, a collagen fertilizer. So when we usually do traditionally, what I usually do with a patient is they're usually going to get one vial on one side of the face, one vial on the other side of the face, and we literally can put it pretty much everywhere. So I might be injecting it into the temples. I'll inject maybe into a little bit of the cheeks. I'm gonna feather it into these smile rhytids. I can come into the nasolabial folds. We can come into the marionettes. The nice part also is I can anchor it back on the jawline and I can put it in front of the ear. So when it does start working, it starts to kind of pull that face and cheek back to kind of help with what is happening over time and age. Is you start to see some laxity and some skin thinning, and you're bothered, right? So
yeah, and so if you're worried about looking like too cheeky, that's not going to happen with the new way that we inject it.
Right.
I think another really interesting thing about Sculptra is that originally it came out for medical purposes. You want to touch on that?
Yeah, so it originally came out FDA approval for HIV patients or AIDS patients because they had just lost so much volume in their face, and so this was a medical product originally. They started tweaking it, actually injecting less than they were doing medically, and started to see that it has a lot of ability to kind of give you what's called that Sculptra glow, that lift. So sometimes my 20, my 30-year-olds might just come in for like one vial once a year just to kind of get what we call the Sculptra glow. But usually if you're starting to see age-related volume loss, or some, oftentimes one of the candidates I usually like to recommend Sculptras are those very fit, those runners, because though they're in really good shape, they've also lost a lot of fat on the face, and so you'll start to see the temple hollowing or the cheek hollowing. And this is a great natural kind of filler or biostimulator that you can put to help with that.
Yeah, and also to touch on that in terms of your runners, they are in great shape, and usually they have a very good metabolism, so their metabolism is really high. Now, for people who have a higher metabolism, they're going to burn through artificial filler, a little bit quicker. So Sculptra is a great option because it is going to last that up to 2 years because your body's not breaking down the collagen as it's artificial like a filler would be.
Yeah, so it's not dependent on your metabolism, I guess is the easiest way. So yeah, if someone feels like they're burning through Botox or they're burning through filler, it's usually because they have a really high metabolism. But when you're using Sculptra, because it's more natural and it's focusing or it's stimulating your own body's production, It doesn't really matter how active you are, what your metabolism is, it's not going to break down any faster. And that's really nice for some patients.
Yeah, and another thing that you kind of touched on was the Sculptra Glow, which is another thing that kind of sets it apart from artificial fillers, right?
Mm-hmm.
So an artificial filler is going in and just revolumizing the area, whereas Sculptra, since it is stimulating that collagen production, it does also help with your skin texture and tone,
Yeah,
right?
yeah. So it's been really popular now, mainly because they call it the natural look.
Mm-hmm.
It's your own body's production. We've seen it a lot also because of the weight loss craze. So a lot of times
Mm-hmm.
patients who are on Ozempic, Wegovy, Zepbound, Mounjaro, semaglutide, some of those weight loss shots, they start to lose a little bit of, they're losing weight everywhere, and so sometimes they lose it in their face as well, and sometimes unevenly. And so Sculpture is a nice product to add there because it's going to give them back that natural kind of bounce or that lift that they once had. So.
Yeah, and a pretty easy injection, would you say, in terms of
Yeah,
like
it
comfort
takes.
for a patient?
Yeah, good point. Yeah, so about 45 minutes to an hour you're here. We do numb you. I use a cannula, so it minimizes any discomfort. We try to minimize bruising. The biggest thing with Sculpture is there's some homework, and that's we want you to massage the area, which is
Mm-hmm.
different than the other products. We want you to massage. We say the rule of five times a day for 5 minutes for 5 days. So that's really the only caveat when you do inject it. And again, the reason for that massaging is to distribute that collagen stimulating those particles all over,
Mm-hmm.
so that when they do activate, they're not activating in one spot. We want it widespread. So
Mm-hmm.
it's in your benefit to do it. And most patients are pretty regimented with it. So
Yeah. And so if Sculptra sounds like something that you're interested in, come on in, right? We do consultations. A
yeah.
lot of people need more than just one thing or need
Mm-hmm.
a treatment plan to address all of their issues. So if you are concerned about, aging skin and sagging, give us a call. Come on
Yeah,
in.
and there's not, again, one like we that's the best thing is like come in for a consultation. I like to pair it. Sometimes I'll do, if their folds are really deep, I might do some Sculptra as like their base, and then we'll kind of put a dermal filler on top of it. Or we might do laser first, then Sculptra.
Mm-hmm.
So there's a lot of different ways to kind of help achieve what you're looking for. But the first part is to come in and talk about it, and we'd love to help you guys out. So look
Yeah.
forward to seeing you guys soon.
Thank you.